Right now, though, I want to focus on the updates we're getting on the coronavirus pandemic front here. We've been tracking new daily cases across the U.S., and the number yesterday coming in at 53,572. And if you've been watching, you would know that that's the first time we've topped 50,000 new daily cases since mid-August. So joining us now to break down what's really going on here with us once again is Dr. Hlatshwayo Davis, an infectious disease physician at Washington University School of Medicine and the Cochran VA Medical Center, joins us on the show right now. And Doctor, it's good to see you again. First, I guess we'll just start with that uptick in cases, because this is something that we raised as an issue a couple times on the show, is kind of the idea of pandemic fatigue, and maybe Americans just getting comfortable with the idea that they can go out because things haven't been disastrous so far. But we still see fears of that second wave in the medical community. So what are you seeing right now on that front, and why Americans should still be concerned about this new trend?
Thank you, Zack. I mean, great concern for all of us over here, because like you say, that pandemic fatigue is a very real and present phenomenon. Americans have done what we've asked them to do, but unfortunately, because of conflicting messages from, upper leadership, it has been difficult to get to where we need to be. Countries that have had a coordinated and clear response from the beginning, and who sort of clamped down early, have been able to enjoy a measure of freedom now, because they were able to reach their targets. Unfortunately, that's just not the reality here. And so what we're seeing is conflicting priorities, and the American public being put in an almost impossible position, right? Where, there's the health and safety for individuals and their loved ones on one hand, and on the other hand, the need to make sure that business is thriving, to make sure that children are able to get to school and have adequate social contact and opportunities for their educational development as well. And so at the end of the day, we still need to be employing the same public health measures that we've been saying from the beginning. Masking wherever possible, when outside, washing hands often. And now we have this data that's very clear about overcrowded spaces, especially indoors, and limiting that. So I do think there's opportunities for public health experts and folks in the business community, for example, to be innovative about how to open up a little bit safely, but in understanding that when these case rates go up and the numbers are going up as we're seeing, it's time to clamp things down.
Yeah, and on that front, I mean, when we think about it playing out on the national stage, that has been one big question mark as both of these candidates prepared or were preparing for the debate next week. And on that front, Fox is reporting that President Trump is not likely to host any campaign rallies over the weekend, but could start again as soon as Monday. Of course, being contagious would immediately make travel a very bad idea for anyone well infected with COVID-19. But we saw his son also host a rally indoors with quite a bit of people there. So what do we know about President Trump's, propensity to be contagious at this point in his recovery, and what should people know about those concerns?
Right. I think what's been difficult for those of us in the medical community who've been asked to weigh in on this is that, the information has been purposefully vague, right? We don't know exactly when he was tested. We don't know exactly what his symptoms were, what his associated lab and radiologic findings were. So it makes it difficult to know when the onset of time we should be paying attention to as far as his ability to be contagious is. But I will say this. We've been very clear in saying that anyone who has tested positive for coronavirus should be in strict isolation, right, from the day of diagnosis for at least 10 to 14 days after that initial diagnosis. So we are very much still in that window. And my concern, because, the president is very fortunate to have the best available care, is for the folks around him who don't have that, right? He has staffers around him who come from the demographics that have been most affected both by severe illness and unfortunately death. They don't have access to treatment that has to testing that has fast turnaround. They don't have access to the best and most available treatments. So it is for those reasons that enforcing that isolation is critical to prevent those around him from also being sick. And then in talking about your second point, in talking about rallies and indoor spaces, This is where the super spreader events are even worse, right? Because there isn't adequate ventilation. And so we have to pay attention to social distancing for at least 6 feet, masking, and adequate ventilation wherever possible.
Yeah, and I mean, again, as we highlight kind of this surge in cases, it is one thing to point out, but other people on the other side of the equation here might point to deaths, and that is one thing that we haven't seen move as high as case counts have recently. In the U.S., it's about 700 Americans dying each day from COVID-19, which is still obviously a very high and very tragic number, but it's about 260,000 deaths a year at that rate. When we think about that and the treatment options that the president continues to refer to as a cure, when he's talking about these antibody cocktails from Regeneron or Eli Lilly, and those seeking FDA emergency use authorization, how hard is it to really point at the data and say, all right, I guess treatments are getting better, and so maybe the idea of a renewed lockdown when we get to the cold winter months, maybe that is out of the question now. I mean, how do you balance kind of the rising cases with the outcomes seemingly not necessarily moving in as a negative of direction?
It's such an excellent question, Zach. And I think this is where people struggle to understand what's at stake here. Just because you're not seeing an as high of an uptick in deaths right away doesn't reflect on what's the severity of what's happening. What we see with this disease and what makes it so difficult to manage is that folks can be in that moderate to severe and critical illness phase, hospitalized for weeks, right? So number one, that means that the death numbers are lagging behind the current uptick numbers that we're seeing. But number two, it's about available hospital resources, right? These are people that need hospital beds, that need ventilators, that need to take up space that otherwise need to be used for a host of other conditions. So we should be looking at this in an overall sense, not just in a contained coronavirus way, but also towards, are we going to have the space to treat a lot of the other illnesses that need to be treated in these moderate and critical spaces, especially with flu season coming? So again, those of us in the public health and medical arenas are very concerned. And this continues to be a space where we need to be highly diligent and where we need leadership to join us in being clear and consistent about what needs to be done.
Yeah, and we already saw across the pond, you can look at examples over there at what could happen here if you take the foot off the gas here and really try to control this. I think that's important to highlight as well. But Dr. Monty Hlatshwayo Davis, always appreciate having you on with us. Thanks again, and be well.
Hey investors, Zack Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.